a lot of couples nowadays, although they are, able to conceive, they tend to have a lot of miscarriages, especially in the first trimester.
Yes.
So the women tend to worry a lot about this and blame themselves more often than not, because they think that they haven't been careful enough, or it's something that was wrong with them, which led to the miscarriage. So why is this happening so often, ma'am, and is there something that they can do to prevent these things?
Miscarriages are about quality.
Okay.
And these days what I have analyzed is 70% of the miscarriages are because of male factor, the sperm quality.
Oh, wow.
So when we have to analyze situations that cause miscarriage, most of the time 3-4 reasons that we can check on. First and foremost is the egg quality or sperm quality. PCOD, bad quality; higher age, bad quality eggs; sperm DFI, if it is high, bad quality; infections, bad quality; varicoceles, it produces heat, bad quality. They can have miscarriages. Second important thing is genetics. If you have some genetic conditions that can cause miscarriage, genetical abnormalities that can cause miscarriages. Third thing is blood coagulation disorders, where the blood thickens to form a clot and the clot goes and hampers the supply and it leads into a miscarriage.
Right.
And there are certain genetic conditions which promote this. The MTFHR gene, the MTRR gene, there are so many IL-10, there are so many genes that promote this kind of a behavior in terms of clot formation. And they also impact folic acid metabolism, so bad quality of egg, bad quality of sperm, and then it lands into a problem. Other than this, we have some structural abnormalities in the uterus also. Sometimes because of septum, sometimes because of abnormalities of the uterus size, shape, you can have miscarriages. So it's all it's like an ocean, and we have to evaluate. And that's why in countries other than India, where we have large segment healthcare is privatized, you have public healthcare systems in other countries. Unless and until you miscarry for 2-3 times, they don't start evaluating you.
Right.
But we cannot do that, because we live on the grounds of compassion, and we would definitely evaluate the reasons and give them solutions that they don't land into such problems. Preventive healthcare is very important, because every miscarriage that happens leaves a lot of trauma.
Right.
Trauma in the relationship, trauma in the woman, and it's extremely painful, both physically and psychologically also. So wherever preventive strategies work, we should help them out. So on the grounds of compassion, we evaluate and understand what problems are there, and then we treat them and control them and give them better outcomes. There are certain situations that we cannot find any reason, but still we go forward and help them with holistic methods. And miscarriage is not always, it had happened. It can be prevented with the right pre-medications and right lifestyle changes. If you are healthy, if you're taking L-methyl folate, the active form of folic acid, you have checked your sperm quality and it's all good. If your egg quality is good, it is ovulating well, then you might not land into a miscarriage that easily. If you have any high risk factors, family history, or if you have had a clot, that's again clot formation tendency showing up. So all these things can be managed and prevented.
So basically, if you are having a good lifestyle and you are healthy, then your risk of miscarriage also goes down.
Yes, it goes down.
Okay, that's very interesting to hear.